Hello everyone and welcome. In this course, we will be presenting information concerning the accreditation.
Let's define the accreditation. Accreditation is the external recognition of your adherence to a set of standards, to perform an activity or hold a certain status. It is held by educational institutions or organizations. The goal of JCI accreditation is to develop standards that promote quality and ensure patient safety. JCI standards set clear expectations for organizations that are reasonable, achievable, and measurable.
In the Joint Commission International we have standards, intent, and measurable elements. Standards, also known as requirements, are statements that define the performance expectations and/or structures or functions that must be in place for an organization to be accredited by JCI and to provide safe, high-quality care, treatment, and services. Standards are evaluated for compliance during the on-site survey. Moreover, the intent helps explain the full meaning of a standard by providing additional background, justification, or other information. The intent describes the purpose or reason for the standard and how it fits into the overall program, setting parameters for what is required by the standard. Although measurable elements are statements that detail the specific performance expectations, structures, functions, or processes that must be in place for an organization to meet the standard and provide high-quality care, treatment, and services.
Here we have an example of access to care and continuity of care. In the Substandard 1.1 declares that the hospital considers the clinical needs of patients and informs patients when there are unusual delays for diagnostic and/or treatment services. Then the intent of the Substandard ACC 1.1 is an explanation of the substandard with more detailed information. After the intent, we have the measurable elements with 3 statements encompassing specific performance expectations.
In Joint Commission accreditation, we have 4 sections. Section 1 is about accreditation participation requirements. This section consists of specific requirements for participation in the Joint Commission International, JCI, accreditation process and for maintaining an accreditation award.
Section 2 is about patient-centered care, and it involves 7 chapters. Chapter 1, International Patient Safety Goals, IPSG. Chapter 2, Access to Care and Continuity of Care, ACC. Chapter 3, Patient-Centered Care, PCC. Chapter 4, Assessment of Patients, AOP. Chapter 5, Care of Patients, COP. Chapter 6, Anesthesia and Surgical Care, ASC. Chapter 7, Medication Management and Use, MMU.
Section 3 includes Healthcare Organization Management Standards. In this section, we have 6 chapters. Chapter 1 Quality Improvement and Patient Safety, QPS. Chapter 2 Prevention and Control of Infections, PCI. Chapter 3 Governance, Leadership, and Direction, GLD. Chapter 4 Facility Management and Safety, FMS. Chapter 5 Staff Qualifications and Education, SQE. Chapter 6 Management of Information, MOI.
Section 4 is the Academic Medical Center Hospital Standard, and it includes 2 chapters. Chapter 1 Medical Professional Education, MPE. Chapter 2 Human Subjects Research Programs, HRP.
During JCI visit, surveyors will conduct the following: interviews and observations. Documents review encompassing strategic plans, budget, policies and procedures, manuals, and electronic health records. Outcome measure review including mortality rate, infection rates, satisfaction rates, and other PI data. Moreover, they will do tracer methodology including patient and system.
Patient tracer methodology, it may start at any location or go back to the first encounter. The review include electronic health records, medication delivery process, infection control practice, medical equipment maintenance, patient and family rights like consent.
In system tracer methodology, surveyors look at systems or processes across the center. It includes the following: medication management and use, infection control, facility management and safety, quality improvement and patient safety, selection of indicators, data collection, analysis and interpretation, validation, and FEMIA and RCA.
There are 14 priority issues and focus area listed as follow. 1. Communication and documentation. 2. Assessment of care. 3. Use of equipment. 4. Credentialing and privileging. 5. Medication management. 6. Infection control. 7. Orientation and training. 8. Organizational structure. 9. Physical environment. 10. Patient safety. 11. Patient education. 12. Quality improvement. 13. Patient rights and ethics. 14. Staffing.
After a long journey of preparation, our center got accredited in June 2023, and it will be re-accredited after 3 years.
Thank you for watching.